right. Hello, All-Star listeners, and welcome to another episode of the Veterinary Roundtable presented by All-Star Veterinary Clinic, the podcast where we answer your veterinary-related questions while having some fun along the way. If you enjoyed today's episode, be sure to leave us a review on your podcast provider of choice. And if you have any feedback to offer to improve the Veterinary Roundtable, let us know. Speaking of reviews, let's read what Skyly had to say about the podcast. So, I'm so happy that I sound like a song. So, I'm so happy. Okay, sorry. We were singing before the podcast.
The right song on here?
Go for it.
I'm too sexy for my shirt.
Too sexy for my shirt. Too sexy. It hurts.
Okay, go ahead.
Okay. I'm so happy that I finally found All-Star Veterinary Clinic after moving to Westfield and trying out 2 other vets. They just weren't the right fit. I found you all and everyone there went above and beyond for us. The podcast is amazing and really gives people confidence to advocate for their pets. It's a great way for people to ask questions and to get educated and informed answers. Plus, you're all just funny and entertaining. Yes, we are. All right. So reviews really help us. Please write reviews. We really love, 1, reading them, but 2, it boosts the algorithm. So write reviews, Spotify, Apple Podcasts, wherever you listen to your podcasts. They really help.
Yeah, they do.
Okay. Next, we have to mention Chowder Kinda Cold.
Chowder Kinda Cold.
It is a book written by our own Dr. Kristen Poles and our own registered veterinary technician, Josie Ellis. And Josie did all the pictures. There they are. Abby, thank you.
Yes.
Abby's in here.
Abby's in the book. Yeah.
Abby is in the book. And these guys did a fantastic job writing a story. Be prepared. There's going to be more Chowder stories to come.
Yay. That's right.
Here I am. There's Abby.
There's Abby.
Look at that. That's amazing. So you can buy it on Amazon. Go check it out. It's a great story to read, kids. It talks about, basically a veterinary visit.
It's also a #1 bestseller.
#1 bestseller.
In our category.
Children's
veterinary book.
That's right.
#1, baby.
#1. Okay, awesome. How's everybody doing today?
Fabulous.
Good. I had a big old coffee.
You're good after your psych music.
Yeah.
Yes, we had a great time before this. We really needed that.
I think you really needed the tunnle.
I did. Well, it's technically my day off, but I'm glad I'm here. Happy to be here.
Yeah.
Okay, that's awesome.
Thank you.
It's been a good day. Been a good morning.
Good. That's great.
Yeah.
Okay.
On today's episode, we have myself, registered veterinary technician Bailey Murray,
Woo-hoo.
room assistant Abby Depew, another room assistant Nikki Skronik, and our co-host, which she's lovely, Dr. Emily King.
Thank you.
Aww.
Thank you.
Yeah,
thank
everybody's doing good today, so let's just keep it rolling with the good vibes.
All right. With the good vibes.
Guess the dog breed.
Okay. I'm going to ask you guys. Yes, sir.
Each of them answer, and then you tell them the right answer.
Okay.
Let each of them answer and then tell them the right
guesses.
answer.
I'm ready.
Do you guys have the answers?
No.
I've read through them.
Okay.
I'm ready for...
In my mind.
I'm ready
All right.
to read them.
Okay, got it. All right. So we, instead of icebreakers, are going to do guess the dog breed. All right. Are you guys ready?
Yes.
Okay. I'm compact, yet muscular. I'm related to Australia's famous wild dog, the dingo.
Dingo baby.
I'm a resilient herder, and I'm this sounds like I'm reading about Abby. I'm a resilient herder and am intelligent enough to outsmart my owner. Standing, I'm usually between 17 and 20 inches at the shoulder. I'm born with a white coat that turns either blue-gray or red. Both coat colors may feature distinctive modeling or speckling patterns. I have an immense work drive and excel. Well, except this part. Okay, no, I'm just kidding. Okay, I find myself so funny. And excel at controlling, of course. Who needs to guess? We just need to read this and laugh. Okay. Of course, moving livestock. I have boundless energy and a supple gait to make
Supple? Did you write this, Aronson?
I see Abby with a supple gait. Okay.
Dang, she got them curves.
Good supple gait. Making me an excellent running partner. I am loyal, famously smart, tenacious, ever alert, and may be wary of strangers. What dog breed am I? Oh, gosh. I can't.
I'm still stuck
You're
on the
actually
dingo.
crying
Yes,
right
I'm
now.
laughing so hard.
Oh my gosh.
Okay, what breed?
Australian cattle dog?
Okay. What's your guess, Abby?
I just want to put for the record, I'm not good at breeds, but I'm going to say blue heeler.
Oh,
That's a
okay.
good one.
Good guess.
Australian cattle dog is all I can think of.
Australian cattle dog.
A
I
blue
could see
heeler
where
is-
blue heeler would
is
fit
it-
into that.
It's the speckling.
Aren't they the same?
Blue-gray
Pretty
red.
much.
Yeah.
Okay, good. I feel better.
They're like the
What you
color
got?
of it.
Shout
So
out to Blue
smart.
Green, best blue healer in the world.
All right. Next breed. I have a famously long, low silhouette, ever alert expression, and a bold, vivacious personality. I come in 2 sizes and a 3.
Are you reading about yourself this time?
I knew you were going to laugh right when you got to that.
Vivacious. Okay. Personality. I come in 2 sizes and in 3 coat types of various colors and patterns. I can be a standard size, usually 16 to 32 pounds, a miniature, 11 pounds or under, and come in one of 3 coat types: smooth, wired hair, or long haired. I'm not built for distance running, leaping, or strenuous swimming, but otherwise, I'm game for anything. I'm smart and vigilant with a big dog bark. I make a fine watchdog. What dog breed am I?
Dachshund.
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 Yes, ma'am. You guys are all correct. Way to go.
I'm just wondering who has a 32-pound dachshund is my question. But
They
That's
are.
not-
The standard dachshunds are big.
yeah.
Yeah, they are.
Big wiener.
Yes. Okay, moving on quickly. I'm large, thickly coated, and an immensely powerful working dog breed. Working dog. Bred to deter sheep-stealing wolves and other predators on snowy mountaintops. I'm a mellow companion and a vigilant guardian of home and family. I'm a big, immensely strong mountain dog standing as high as 32 inches at the shoulder and often tipping the scales at more than 100 pounds. I'm a steadfast guardian that exhibits a zen-like calm, but can quickly spring into action and move with grace and speed to meet a threat. I have a lush, weatherproof coat that's all white or white with markings of beautiful shades of gray, tan, reddish brown, or badger. What dog breed am I?
Can we do it all together?
Sure, if y'all know it.
Do we
I
all know it?
think it's one that we don't see very often here.
Oh,
So
what?
I'm between 2. My first thought was the Great Pyrenees, but my second thought is a Maremma sheepdog, but I know
Ooh.
that they really only come in white.
Okay.
And Piers normally are only white, but they do
They
have
do have, like,
markings.
markings.
Yeah, I was going to say
So,
Great Pyrenees.
Yeah. Great Pyrenees is what I'm
All
going
correct
for.
again.
Wonderful.
You guys
Yeah,
are
Maremmas
so
are weird.
smart.
Maremmas are very
What
weird.
are you saying?
Maremma.
It's a Maremma sheepdog. They're
You've met the
Italian.
patients.
Oh, okay.
You
Yeah.
know Mac and Ollie? They're
Oh,
really
yeah.
naughty ones.
Italian.
They're Italian.
Got it.
In the
Italian.
mountains. The mountains.
Oh,
Protecting the sheep.
of
Italy.
We're on a podcast.
All right. On to case collections.
Yay.
Who wants to start?
I guess I can start. Mine's not that.
Nikki's got
It's
an
not
in-depth paper.
fascinating. I mean, it can be fascinating, but it's just like an alert to just be careful. Because this can
I like
also
the public service.
this
list.
can also happen to us as humans, but it's just to be careful. You
All
just
right.
never know.
Okay.
So we had a new client, a new patient. He is a 10-year-old cat named Chester. Sweetest boy ever. He's a little bit of a pushover with his sweetness, but I would rather deal with a sweet cat than an angry cat, you know?
Yep.
So he presented with a very squinty left eye, super sensitive to light. Owner knows exactly what happened. And he let us know that the night before he was giving Chester a bath with some antifungal, antimicrobial shampoo and accidentally managed to get some of the suds into his left eye. His right eye was completely fine, unaffected, no suds got in there. So Dr. Jones, being the great doctor that she is, wanted to practice gold standard medicine and make sure that we did some diagnostics before prescribing any medication. So we did a fluorescein stain, and his cornea actually under that black light lit up to covering 50% plus of his cornea being scratched or possibly covered in some type of wound. So what Dr. Jones decided to do was start treatment with afloxacin, which is an antibiotic drop, and then iVet gel, which is like preservative tears. So keeping that eye super lubricated, but it was significant. So we're going to see him again for a recheck here next week. And then we'll probably go from there as far as like treatment's next step goes, just because it was so bad.
Yeah.
But just a PSA to be aware that just like with humans, if we get shampoo in our eyes, it's super painful and not fun and could cause an ulcer. That also can happen in pets and it's not fun. So that's all.
Yeah.
I wonder how many
Wow.
ulcers I've had gone undiagnosed from
Yep.
my eyes.
Yep.
Because I got a lot of like Head and Shoulder shampoo in my eye as a child. So
That's not good.
I feel like that's a problem.
Well, there you go. Well, you are wearing glasses. I don't
Mhm.
know.
Hey.
Listen.
We all
3 to
are.
1
What
right
are you
now.
trying to say?
You got yours on top of your head.
Chemical burns are a real thing. So with the ulcers, yes, it's a common thing because the dogs won't be like shampoo or cats shampoo.
Yeah.
Did he have to wear a cone or anything?
He wasn't going after it, which is nice.
Yeah.
But I mean, you could tell it was really bothering him.
You can't put, if you are a person who likes to bathe your cat.
You can do like a.
You can do.
I ain't bathing my cats.
But if you're going to do that, you can use artificial tear ointment, which you can buy over the counter.
Yeah.
You could put that in the eyes prior to,
protect
and in
it.
dogs' eyes prior to bathing them. And
Oh, is
then
that
that
like
helps
our-
protect their eye.
Our Optimune.
Not Optimune, just
The eye-
artificial
yeah.
tears.
Just artificial.
Just artificial tears, but the ointment, because it's more
Right.
occlusive.
They also, fun fact, I watch a groomer on YouTube, and she grooms like long-haired cats, and when they're really mean, she'll put a bubble on them. on their
Oh, I
face.
love those
I've
things.
seen
Those are my
those.
So
Like a
favorite.
hamster
literally,
ball.
it's literally like a hamster ball. They look like they're an astronaut, and that's how she
And you can
grooms
put them on. You can put them on
So-
pugs
yeah.
and bulldogs and all the naughty breeds.
So
that
just
are
a thought: if you
short-faced.
give your pet baths,
And
pop
humans.
a little bubble on them. There you go.
I think we should totally use it on humans.
Yep, babies. Let's do it. We don't need any baby.
Have you seen how they
shampoo.
take baby X-rays? They like stick them in a
Oh,
tube. with
yeah.
their
And they're
arm.
just like sitting in this little clear tube and they're like, I'm a baby.
I'm a baby stuck in a tube.
What do I do?
Sorry, that just made me.
It did,
do that.
yeah.
Oh, Abby, what's your case? That was a great case.
Yeah, good case.
Yeah.
I don't know how to follow up with that because you had all kinds of medications and things.
I had all the information.
So same thing we have, not same thing. New patient, new client, Charlie. He's 9 months old. He was Bernedoodle, sorry. He actually presented for excessive drooling. He had just been drooling all over himself. Dad said before he got there, he was pretty lethargic. Once he got in the building, I mean, he's 9 months old. He was happy as can be, but I went to love on him and he was soaked. Like his paws were all wet and everything. He was still a little drooly in the room, but happy. So come to find out, the owner's son found the dog outside near a dead toad. So, toads can be poisonous to dogs, sometimes deadly. The one that we're thinking, the son took a picture of the frog, and I might be pronouncing this wrong. It's a pickerel frog or toad. It's really common in this area, southern area too. But he may have licked it and just caused excessive drooling because they can secrete
Toxins.
yeah, toxins that can be poisonous. But we sent him home. I mean, he got some Serenia, so anti-nausea, some fluids. A couple days later, I texted Dad, and he's back to normal, doing just fine.
Yay.
But definitely a closer eye in the yard.
Them toads.
Them toads are coming out, guys. Be careful.
There's a lot of them out right now. What you can do too, if that happens at home, you can rinse their mouth out with milk,
Oh,
and that usually fixes the
Neutralizes it.
problem.
wow.
Yeah.
Wow.
So you just rinse their mouth out. Yeah, as long as you rinse their mouth out, you're good.
And be careful with those wasps and bees and
Yes.
fireflies even, but they're not out very often right now.
You know what? And while we're
Fireflies.
on that, check your dog for ticks when they come inside.
Oh yeah, it's been terrible this year. I'm sure other.
In between those
Veterinary
toes,
clinics.
those ears, everywhere. Check
So yeah, good job, Charlie. Well, actually, not good job for licking the toad, but good job for feeling better.
Yes, that's awesome.
And good job, owners, for taking a picture of what they thought could have been the problem.
And bringing him in.
Yeah,
Pictures help always.
absolutely.
Always.
My case.
Bailey, what's your case?
This happened about a month ago. But we saw her. She's a 3-year-old spayed female. I want to say she was like a Bernedoodle type of dog, like a shepherdy Bernedoodle type of dog. And she ate a whole bottle of Vet's Best Comfort Calm pills.
Oh yes, I remember. Oh yes.
Within like a 2-hour span.
That
so
was presented as an emergency, right?
yeah,
Yes.
it's presented as emergency because we didn't know when she ate them. We didn't know how many she ate, and we don't know like anything else. The owners basically found like a chewed up bottle, figured she ate the whole thing, and then called us immediately. But she could have eaten them in a 2-hour span, so they called us at like noon, and we got her in. And so the active ingredient in those is 5-hydroxytryptophan, which is like the sedative portion of it. But she came in lateral, lethargic, and urinating on herself. And those are kind of your presenting things for marijuana ingestion or even just like sedation ingestions, really. They just lose control.
Yeah.
But on exam, Dr. McDivitt found she was tachycardic. She responded to stimulation, and then they also ran blood work just to make sure, no organs were being I don't even know.
Affected.
Yeah, affected. And so her blood work came back good, which is what we like to see because we can always get them back to normal pretty quickly if that happens. She was hyperthermic though, so we were really concerned about that. So we started getting our temperature down, started bolusing fluids, ice packs, alcohol on the paws, everything that we could. And then overnight, she stayed overnight with us because she was still lateral lethargic, and she started to get better towards the end of the day, but we wanted to make sure that she was gonna make a full recovery by the next morning. But we kept her on IV fluids. We had a technician stay overnight with her just to make sure that her neurologic state was still good. And then they also gave her Clever, which is like a vomiting. That's the brand name of it. It's a vomiting drop that you put in their
eye drops.
Yeah, in their eyes, and it makes them vomit. No, we did.
We did.
have it
Okay,
here,
I was
yep.
like, wow. The
And so we gave her that just because if she did ingest something within the 30-minute window that we had, because they said that the latest would have been 11:30 that she could have ingested it. So we were like, let's see if we can get some of it out, and if not, all of it. So we gave her that, but she was still kind of obtunded and lethargic. And then the next morning, she got better. She was eating. She walked outside by herself. She was doing great. So she made a full recovery. And from what I know, she's doing well. She came in a couple of weeks ago for an eye problem. So otherwise, she's doing great. So hopefully.
It's like she ate 20 turkeys.
Yeah, she just needed
tryptophan.
it after Thanksgiving nap.
Yeah.
That'll get
Yep.
you.
Exactly.
But she took
Hospitalized
a
nap.
good nap with some fluids. And
Yeah.
was-
She
you
was
go.
hilarious,
All
but
right,
she
right,
was
right.
totally out of it.
Dang.
You said
Yeah.
she was 3?
yeah, she's
Aw.
3. Her name's Gus. I like that.
Oh,
Her name is Gus.
That's so cute.
I like that.
We always kept
Boy named
misgendering
Gus
her.
the
We
girl.
tried our best.
Gus the girl.
My case is Dudley's case, actually, which is, I don't remember how old he was, but it's a Rottweiler, I think he was like 3 or 4, 4-year-old Rottweiler that came in for squinting. And so he presented for squinting, and Dr. Dudley did a full exam on him, and her ophthalmic exam revealed that he had entropion, so he was rolling his eyes in because he was painful. She did not see anything else on eye exam. And so, she also did a Schirmer tears test, which showed that he had dry eye, a little bit of dry eye. So, yeah. So she sent him home with medication, Optimmune to fix the dry eye or to address the dry eye. And then the owner called back, or we called to check on him, I think the next day, or she called in to tell us about how he was doing the next day. And he was actually getting worse. Now he was bumping into things. And so they were seeing symptoms of blindness, which we did not see 24 hours prior. So Dr. Dudley did send him to the ophthalmologist. And then Dr. Davis, who's one of our local ophthalmologists, diagnosed him with retinal detachment, bilateral retina detachment, and granulomas involving his retinas. And the most common thing that will, and then anterior uveitis. And the most common thing that will cause that is either is infectious disease, so blastomycosis, which is a fungal disease, or tick-borne disease. So she did submit panels, and we found that he was positive for blasto, and he was also positive for Rocky Mountain spotted fever.
Double.
Yeah. So he is currently on antifungals and doxycycline to treat the tick-borne disease, and is improving, but unfortunately blasto and blindness, like usually we don't see recovery. So the pet typically stays blind.
How rare is that Rocky Mountain spotted fever?
In Indiana, we do not see it very often.
didn't
I think
think
we
so.
looked up, Dr. Faust looked up how many cases we've had since, I can't remember when. It was only like 208.
Oh,
I mean, I guess we
wow.
don't see it very often at all.
Wow.
No.
So strictly
I
for
remember
just
that appointment.
antibiotics.
Yeah.
Because they came in on emergency because mom was like, he's down in the back end. He's got eyes. He doesn't want to open his eyes. It's been for 24 hours. So when Dudley diagnosed him with dry, we were like, oh, emergency dry. But then I didn't know about the follow-up portion.
Yeah.
So that's, yeah.
Yeah, poor guy. So
Wow.
very interesting. And he hadn't traveled anywhere. So blasto is typically a southern disease. Like we see it in warmer, wetter climates. And so, yeah, very interesting case.
Wow.
Wow.
Very quick,
That is.
too.
Yeah. Yeah.
Goodness.
Very
Hopefully he
interesting.
makes a full recovery because I do love him.
Yeah.
He's a good patient.
Yeah.
That's good.
His family's a good family
Yeah.
as well.
All right, great cases. So before we jump into listener questions, we wanted to provide an update on the question we received for episode 31, where we had an in-depth discussion on Addison's disease. And Bailey, do you want to read this? You
I
can if you want.
I will.
So this is from the owner, an owner who had a pet with Addison's disease and had this question. So
Yeah.
Go for it.
So the owner says, I hope this email is okay to send in regards to the Veterinary Roundtable, as I wanted to provide some updates. I finally got around to listening to the podcast from January 13th regarding Addison's disease. It was actually my question. Username on TikTok was Logan Elise 21. So I thought I'd give some answers, even though it's been a while. You all were completely correct with the poodle mix identification. Ember May is now a year and a half old Burmese mountain and poodle mix, which is Bernedoodles. She went ahead and attached a photo, and it's super cute.
How cute
Look
she
at the
is. Look
smile.
at Ember.
She looks more poodly.
She does look more poodly.
She's very cute.
But she has Addison.
cute
So
name.
Ember was around 6 months of age when she got spayed with a full blood panel, no significant indicators for worry. When approximately 3 weeks later, I came home from work and she had been sick in her crate, which is not normal for her. I don't even know what number.
100,000 millionth percent anxiety-driven dog.
Yep.
Yes.
Lots of driven anxiety. Dog mom and me knew this was not good as she refused all food, dry dog food, wet dog food, treats, and human food, which, oh, that's a big no-no. Better start worrying more. And at approximately 10 p.m., I rushed her to the ER vet, freaking out. They diagnosed her just as the normal upset GI tract and gave her some fluids along with Serenia, the injectable Serenia. And the next day, I noticed she wasn't getting better. My normal vet called, and I immediately got her in for more fluids and Serenia, and that's when my vet told me about how here recently, poodles tend to have a higher risk of getting Addison's, and she wanted to knock that off the list of possibilities as soon as possible. I guess I could count myself lucky as I had a great vet who was aware and wanted to test for the right away for the Addison's right away, especially since it is a great imitation disease. 3 days later, and the truth was given to me that my puppy was officially diagnosed as an atypical Addisonian puppy. My world crashed down a little bit because I didn't know what that would mean. It scared me to death. But today I'm so lucky because I'm finding out more and more info from amazing vets like you all and others. Ember is thriving and is almost at her 1-year diagnosis anniversary. She is still atypical and only required prednisone as of now. But I just really wanted to thank you for continuing to spread awareness of this disease. From your Ohio fans, Logan Pearson and Ember May.
Oh, so
Yay.
cute.
Ember May.
Very cute. Very cool. We love that.
Great name, by the way.
People are-
Addisonian can be scary. It can be very
Great
scary.
imitator is what we call it.
Mhm.
Yeah.
It is one
Yeah.
of the true emergencies that we have. We
Yep.
don't have very many, but that's one of them.
Mm-hmm. It can
So,
be very scary.
Wow.
okay. Very cool. Thank you, Logan, for the update. That's always
Yes.
fun to find out what's happened with patients when we
We
have those
love to
questions.
see it.
All right. You want to go on to our next listener question?
Can.
Okay.
Look at you go, baby.
So our listener question for today is from DJ, and she says, "Hello, my name is DJ. I'm a veterinary student at UC Davis and a listener of the podcast, which I should mention is very hysterical. We're so funny.
I know. I love it that people think we're funny. Okay.
We think we're funny.
I'm trying to build my clinical acumen, and I would love to hear your perspective on what your go-to first line of treatment is for canine atopic dermatitis. I've worked in several practices, and the doctors waffle on what the first line of treatment should be.
Cytopoint.
Or Apoquel. Assuming owner compliance, what would be your first choice? It really
Okay.
depends on the patient
Mm-hmm.
and the
Well,
owner.
and their age, right? So, Cytopoint can be used on
Save.
any age, basically any age
Mhm.
dog, but Apoquel can only be used on dogs 1 year or older.
Mhm.
Mm-hmm.
So if it's a puppy, then we don't really have a choice.
Right.
We're going to be using Cytopoint.
Right.
Yeah.
If it's Apoquel, then, if it's over a year old, then I'd say the reason why you see waffling amongst the veterinarians could be for several reasons. So one may be pricing.
Mhm.
So the larger the dog, the more expensive the product's going to be
Yep.
when you compare Apoquel to Cytopoint. So if you have a small dog, like under 10 pounds, it might be more reasonable for the owner to use Cytopoint
Mhm.
than Apoquel. So you might see a veterinarian choose Cytopoint versus Apoquel. You might see them choose Cytopoint because they don't like tablets,
Right.
because they don't like
Yeah.
injectable. So then an injectable is an easy thing to do.
Yeah.
Owner compliance might be the other reason. So the owner is traveling, and they their mom's watching the dog, and so they don't
Mhm.
want to make their mom give tablets. Again, another reason, Cytopoint.
Yeah.
Taking all those variables off the table, I will always start in a dog over 1 with Apoquel. And the reason that I start with Apoquel first is that it's going to block 5 cytokines versus Cytopoint only blocking 1. So I will start with Apoquel because I know I'm blocking all of them. And then I will then potentially move a dog to Cytopoint based on its response to Apoquel
Yeah.
if the
That was my
Cytopoint is going to be cheaper for the owner. Now, the Cytopoint, people who use Cytopoint will also have Apoquel in their medicine cabinet at home, because you will have rescue. You want to have Apoquel to rescue the dog when the Cytopoint wears off, because we all know that's going to be on a Sunday or a holiday or something when
It's
they
always
start
gonna be
tearing
that
their hair out.
Saturday,
Right.
you know?
It's gonna
like when you can't get in.
can't get in. They're going to be tearing their hair out. So you want something that you can give the dog when your Cytopoint wears off. So and then you have some people who, Cytopoint, right, is immunotherapy. It's not drug therapy. So for some people, if they want a more holistic approach, if you will, then antibody therapy or immunotherapy might be a better choice for them versus drug therapy.
And I think that's one of the main reasons why Dr. Jones opts to use Cytopoint is if they're on medications, if they have, prior known health issues, that sometimes she just wants to err on the side of safety. So,
yeah.
My kiddo's on Cytopoint and it lasts her a long time, but I'm leaning more towards Apoquel because her seasonal allergies seem to be getting a little bit worse. Like do a Cytopoint injection, keep going with Apoquel if we need to, but we haven't discussed that with the doctor yet, so we're just gonna see how our Cytopoint works.
And there are times where we have to use them together. It doesn't happen very often at all, but there are times where we have to use them together.
Yeah, I've only seen like one.
And she's a hefty lady. Okay, she's about 100 pounds.
Don't say that about her.
I mean, I would say the other reason too would be like if you're giving Cytopoint, which you can use every 4 weeks. Now, I think the research shows that every sequential injection, you typically should get longer, and there are percentages, longer time between injections. And by the third one, I'm going to quote wrong, but 60 to 70% of the patients should be able to be controlled at every 3 months. But you have patients that can't be. So then you're using it every 4 weeks, in which case it's not, in my opinion, it's not cost effective to do something like that. Right. Unless you have a patient who just can't take the tablets. Can't get the tablets in them. They're not going to take them, whatever.
Yeah,
the reason is.
Maggie, she's on Cytopoint, but it lasts her, it depends really, but like spring 4 to 6 weeks, winter, like fall is when she gets really bad seasonally. Then it's about like, it could really last her 2 months in the fall, which is weird to me because in the spring it lasts her shorter, but in this fall, like it lasts longer. So it's weird. But
so I think to the listener's question, there really isn't a right or wrong. Now, what I will tell you is the fact that you're using Cytopoint or you're seeing veterinarians use Cytopoint or Apoquel, that should be the first line of treatment. You should not be using steroids and then saying, okay, if steroids don't work, then I'll pull out Apoquel or Cytopoint. That is old medicine. We don't need to be doing that. We definitely need to be using one of these two products to address seasonal allergies right off the bat.
Right. Yeah, get that dog stop itching.
Yep.
Make it
because owners get really
problems.
frustrated, right, over time. It's like, so if you're not fixing, you really ideally want to try and fix their problem the first go around. They're going to spend less money, even though Apoquel or Cytopoint might be more expensive. They're going to spend less money. So versus treating them with something less expensive and then seeing if it works, it's not good medicine. In my opinion, there are a few things steroids are needed for, and from a dermatologic standpoint, immune mediated disease, there are some things that we need to use them for. But if we're talking about atopic dermatitis, you do not need them. And so you really should be using one of these two products as a first line.
Yeah. So. And it just makes more sense. Stop the itch.
Fewer side effects.
Stop them from causing self-trauma and move on with it.
Yeah.
Figure out the problem once you get to the point where you need to. But if it's just seasonal.
When you guys see us use those products and you guys are the ones making the calls to check on the patients, what do you hear from the clients? On rechecks, callbacks.
Feedback is always either they're doing really well. Yes, I've noticed like in a week they're doing well, or yes, less chewing at the paws, maybe still a little itchy here. So it's really back and forth, and it depends on like what they're using too. Like, like you said, if it's Apoquel and they're not getting the tablets down, obviously it's not going to work.
Right.
But yeah, for the most part, if you're doing something for your pet, then hopefully they're going to improve.
Right. I mean, I find that it does definitely improve in most cases when we're checking in. I mean, obviously you'll have the oddball where it's like, maybe we do need to treat that with a little bit of a, steroid or an anti-inflammatory. Maybe we need to look for
something
possible, bacteria, further diagnostics, things like that.
But even when they come in for seasonal allergies, like they're licking at their feet or something, we always do skin cytologies. I know you guys are always doing skin cytologies or ear cytologies or something like that.
Bad this year too.
To help.
Really
it has been
bad.
really bad. We've done a lot of Cytopoint this year.
A lot of cytologies.
But for them, they check for bacteria before we even do anything else. So we might even just do Cytopoint and an antibiotic just to help with that. So a lot of the time when they check in, they've already been treating the infection plus the itch is gone. So then they're not causing more infection on top.
I will say, though, that
helps as
sometimes some owners will decline Cytopoint or Apoquel because there is an infection present. They think maybe they don't need that to break the itch cycle, but you do.
You do.
Yes, you
Otherwise,
do.
you're on a roller coaster ride. So
You're going up and down.
Yeah,
That's
you're going
right.
up and down, because the allergies and the way the allergies work, they break down the cytokines, get released when the animal's exposed to the antigens, and then you have a breakdown in the skin barrier. And then those normal bacteria and the yeast that live on the skin become opportunistic. So you have to stop the cytokine release. That's what these products, now Apoquel and Cytopoint will not, if you have secondary invaders, it's not going to address those. You have to address those in order to get the patient, to a steady management state.
Yep.
But any seasonal allergy is management, to your point of your dog. You can't, we're not curing these patients, we're managing them. And I think that's the most important thing to understand, for those owners to understand the expectation that this is a management disease. We aren't going to fix them and then you move on.
And it's not like a one shot cures it. It's one shot and then we'll see how you're doing in 4 weeks, 6 weeks.
Right.
It's kind of
another shot and keep going.
people too.
Oh, yeah,
Like,
for sure.
Allergies, there's no
Let me tell
cure.
you.
Yeah. Yeah.
Let me tell you.
Yep. Yeah, absolutely.
Been through it.
It's a very neat topic. It's very interesting. And the companies have done a really good job of giving us products that, because I'm old, we initially practiced with none of these drugs. And, what we would see these
what
pets,
were you doing?
prednisone.
Yeah.
And then you cause more secondary Cushing's.
Oh, just like a Cushing's or,
side
weakening of tendons and ligaments because they're on chronic steroids. But I mean, you don't have a choice in some of them,
and then you didn't have the medicine.
And then Atopica came out, which was which is a cyclosporin compound, which then gave us some relief from steroids, but had a little bit harsher side effect profile from like a vomiting perspective. Then Apoquel and Cytopoint came out and it's been a game changer.
I will say they need to make game changers for cats. My cat's still taking
They're working on
Atopica.
it.
I know, and I'm excited.
Well, it's just like the new canine osteoarthritis drug coming out.
I'm so excited for more cat research to be done and more cat products to be out because Atopica is not fun to give your cat.
No,
I wish I could do an injection.
Yeah, like Silencia.
Yep, injectables are great for cats.
They are.
We love the injectables.
All right. Well, thank you so much for that question, DJ. And, keep up the good work out there in UC Davis.
Yeah. You got this.
All right, everybody. Thank you so much for turning into another turn the page, tune in to another episode of the Veterinary Roundtable. Remember, send in those questions and be sure to follow us on all social media platforms at All Star Veterinary Clinic. If you enjoyed this episode or a previous episode, leave us a review on your podcast provider of choice. Myself and this vivacious crew.
Vivacious.
See you in a few weeks for the next episode of the Veterinary Roundtable.
You had a note on that.
I did. One
That
note.
was beautiful. Yay!